So you want to be a women's and children's nurse. Hi, this is Dr. Jan, and I'm going to give you some inside tips on how you can get a job in women's and children's services. Women's and children's services is one of the hardest clinical areas to get into, and it's more difficult if you're a graduate nurse. To be successful, you must immediately stand out from the competition, as most organizations limit the number of positions for graduate nurses, especially in the specialties. Here are a few tips that may put you ahead of the crowd when applying for residency programs or as a graduate nurse in the specialty area. Do your homework and be prepared to make some phone calls. Call your hospitals of choice and ask what opportunities are available for graduate nurses. Look for hospitals who advertise interest in hiring new grads. The best places for new grads are not always the ones offering sign-on bonuses. Find out if your school has a relationship with a local hospital. Look for hospitals who have residency programs. Organizations with established programs have designated education staff who can answer your questions and help you through the process. Ask about the entry requirements and when the application deadline is. Here are some things you can do to help you get your dream job offer. Work PRN as a nursing assistant. Volunteer in your last semester. Complete your capstone. Use existing contacts to your advantage and ask for shadowing experience. Finally, make sure your resume and cover letter are ready to go. Hi, this is Dr. Jan, Nurse Mentor, and I wanted to take some time in this series of videos to answer some questions that I've received from you. Question 1. Why do they limit the number of new grads in labour and delivery? The number of new grads training at one time will depend on the size of the unit, the volume of deliveries, number of preceptors available, and the number of nurses with less than 2 years in labour and delivery. Graduate nurses need intensive precepting and support to be able to care for patients safely. When starting a nursing career, you're learning how to practice those new nursing skills. You're also learning about the unit and the hospital culture, getting to know the team, practicing how to critically think, communicate, and care for patients. All L&D nurses are proficient in L&D and general nursing skills. By the end of L&D orientation, you must be clinically competent to take responsibility for an L&D assignment. When there are too many graduate nurses training at one time, we cannot fulfill our commitment to your training or guarantee the safety of our patients. Another question I've received is, how long does it take to train for L&D? It usually takes 18 to 20 weeks to become ready to take an L&D assignment. There is a limited number of preceptors, and they should not have more than one patient at a time when precept. The role of the preceptor is to facilitate your learning by answering the questions, explaining processes, and providing supervised time for you to practice your L&D and nursing skills. A graduate L&D nurse may need mentorship for up to 2 years after graduation, or must have a strong team of nurses available to provide ongoing support. Some of you asked, why do I need 18 to 20 weeks of training? L&D has 7 or more distinct areas: triage, antepartum, labour and delivery, operating room, recovery, newborn resuscitation, and immediate postpartum and newborn. Each element has specific skills and competencies that you need to have signed off before your orientation is complete. Your preceptor is your guide, who will help you to learn the skills that you need to be successful. You will be expected to mirror your preceptor's schedule to make sure you have the consistency in your orientation and training to labour and delivery. Ultimately, your success relies heavily on the amount of work you are willing to put into learning new skills and your ability to demonstrate those skills. In L&D, complications happen fast, and labour and delivery nurses must be prepared to respond quickly to an emergency. You must be willing to put in the time and effort so that you are ready to assume your role as a novice L&D nurse at the end of 18 to 20 weeks of orientation. Here are 2 additional questions. What training, certifications, and classes will I need for L&D, and how much study will I have to do? You will be learning how to care for pregnant women and their infants before, during, and after delivery. The educator will coordinate any additional training and certifications you must complete during your orientation. Basic fetal monitoring, neonatal resuscitation competencies, and sign-off in all areas within labour and delivery. You will have regular touch points with your manager and educator to make sure you are progressing in your orientation. Keep your books open and continue to study. You are no longer a student observer. One of the most common questions I've been getting is, do I need to know about med-surg nursing in labour and delivery? Yes. Pregnant patients are getting sicker and require management for pre-existing medical conditions. Diabetes, hypertension, mental health conditions, and other healthcare issues have become more common in childbearing age groups. That means you will be managing pre-existing medical conditions in pregnant patients. Sometimes this requires high-risk medications such as magnesium sulfate and insulin. If you are working in a tertiary level labour and delivery, you may have an OB-ICU. You must continue to practice and refine your nursing skills assessment in addition to learning about L&D. Take advantage of all of the educational opportunities you are offered and stay focused.